You'll notice today I don't have a sign language interpreter with me, but I can assure any viewers who would otherwise be using sign language to follow the media stand-up that we will have a written transcript available on our website as soon as possible after this session. I have with me today Professor Sunny Collings, who is the Chief Executive Officer of the Health Research Council. She's going to speak shortly about a research initiative that the HRC has just announced. This relates to a $3 million research fund into issues around the current COVID-19 outbreak. And we anticipate any research funded through this fund will not just guide our planning and preparation for this outbreak, but also our future planning and response to these sorts of events. So I'm going to hand over very shortly to Sunny. I think this is an exciting initiative. It's great, and I know a lot of people have put a lot of hard work in to develop up this proposal over the last week or so, and I'd like to hand over to Sunny to talk a little bit more about it.
Kia ora koutou. For those who aren't aware, the Health Research Council is the agency responsible for commissioning a significant amount of government-funded health research and investment. It's about $125 million a year, so significant investment. So 10 days ago, I got back from Geneva, where I attended the World Health Organization's Global Research and Innovation Forum for COVID-19. And since then, our agencies have worked together to pull together this $3 million research fund. In Geneva, there was a lot of discussion, not just about the basic biology of the virus itself and the way it affects infected people, but also about the social impact of events like this, both within and between different countries, and the need to understand just how this continues to evolve. International support for research across this whole spectrum was seen as imperative. The World Health Organization is going to be pulling together a process to ensure that the research community can see what's being done elsewhere, to enable collaboration and reduce duplication. And the health research community in Aotearoa, New Zealand has international standing, and those people are very, very well connected. So this fund also helps capture the benefit of those connections that our researchers already have. The $3 million fund we're making available could go towards a broad range of research, including helping with vaccine development for COVID-19, analysing how New Zealanders have accessed the public health information on offer, looking at different models for health service responses, looking at how responses can be led in ways that are appropriate for Māori and Pacific communities. How do we ensure that our health system response doesn't magnify health inequalities? And we're also mindful of our role in supporting our Pacific neighbours. And these are just examples. We're looking for a wide range of innovative projects. It's situations such as this that show that our investment in health research in Aotearoa, New Zealand is well placed, and I'm really confident that our researchers can and will be able to contribute meaningfully to the global efforts in answering important research questions, at the same time as making sure the findings are relevant and beneficial to New Zealanders. And I'm really pleased that we've been able to devise this in such a short time. I've been back in New Zealand for 10 days after that meeting. And at this point, I would like to thank the Health Research Council staff and all those in other government agencies who have worked incredibly hard to pull this together to get it to this point. So at this point, I'll hand back to Ashley, and we can have questions later.
Thanks again, Sunny. I should say before I go on, as I usually start these briefings with, I confirm we have no suspected or confirmed cases of COVID-19 in New Zealand at this point. Over 100 people have been tested as part of ongoing assessment, and with a low bar for testing people, no positive tests at this point and no suspected cases. Just turning to the current border restrictions, we're at the point in time now where those current restrictions expire at midnight tonight. As you know, Cabinet has considered a paper this morning on whether those should be maintained or indeed extended or modified in any way, and the PM will be announcing that decision at her post-Cabinet press conference later today. As you're aware, at the moment, the restrictions apply to people other than New Zealanders, people who have travelled in or through China in the 14 days before they arrive in New Zealand. And we also have a similar restriction on people who were on board the Diamond Princess, who might be travelling to New Zealand within 14 days of having come off that boat. Right from the start, we have impressed the importance of those restrictions being temporary in nature, and that continues, and we will continue to review them every 48 hours. As you may be aware, there were quite significant developments globally over the last 48 hours. In particular, a big increase in cases in Italy and in South Korea, and a number of deaths in Iran, with an increasing number of cases there. We're following this very closely and have asked from our technical advisory group on whether we should extend, in the first instance, our case definition for a suspected case to take in some of those areas where we've seen that big increase in cases over the weekend. So we're expecting that advice from our technical advisory group in the next 24 hours, and we'll adjust our case definition in response to that advice, and that will also inform any advice we give to ministers about whether or not the current travel restrictions could be extended to include other places. I just also want to speak directly to the question of whether we are in a pandemic situation. At this point, we're not. A pandemic is something that the WHO would declare, and as you can imagine, they will be looking very closely at the developments, especially the increasing number of cases in regions beyond Asia. But at the moment, they will be reviewing that status regularly, and we, of course, will take our guidance from them. So saying, we are, with the developments over the weekend, closer, I think, to a situation where a pandemic could be declared. And so we're, of course, adjusting our planning accordingly to ensure that we are now moving into a point where, if a pandemic was to be declared, we would be ready to go with the sorts of measures, even though we still do not have a case here in New Zealand. At Whangaparāoa, as you may be aware, it's been reported that one of the 6 New Zealanders being cared for there was in hospital over the weekend for an unrelated condition. As a precaution, that person was tested for COVID-19 and the test was negative. They've now been discharged and are back with the group in Whangaparāoa, who are otherwise all well and being looked at daily, cared for by a GP and assessed daily. And my final two comments first relate to the folk who came back from the Westerdam ship, which was the one that docked in Cambodia. You may be aware that we'd had 13 people return to New Zealand. Our initial advice was that they go into self-isolation. We've now lifted that requirement in discussion with colleagues in the US, UK, Canada and Australia, because it seems apparent that there was only one case diagnosed on that ship. That person is now negative, and despite very widespread testing of the people who were on that ship, no one else has returned a positive test. Finally, just in the last 7 days, just to give you a feel for the number of people travelling from China to New Zealand, around 200 people a day in the last 7 days, either coming directly from China or from somewhere else, but having been in China in the prior 14 days. So over 4,200 of the people who have travelled here since the 3rd of February, 4,200 people will have finished their 14-day self-isolation period, of a total of around 9,350 people who have travelled here in that last 14 days. So once again, a huge response from people, many of whom have registered with Healthline. They have voluntarily undertaken this self-isolation, and that's a key contribution to our efforts to maintain New Zealand's current preparation and planning, and also the fact that we are still free of COVID-19. I'm happy to pause there and open the floor to questions. And Sunny, please come closer, because any questions around the research, I'll hand over to you.
Actually, if a pandemic declared, what would that do to change your planning?
So, in a sense, we're already moving to plan as if a pandemic had been declared. We think now it's the time to do that. What that does then is it just formally would release or make available the release of supplies. For example, our personal protective equipment supplies and other supplies that are specifically ring-fenced for that sort of situation. We have already got a very good idea in discussions over the last few weeks about our hospital capacity around ICU beds and our negative pressure ventilation rooms. So we'll put that information up on our website around where those facilities are. The other thing is we'll step up our planning around what might happen in community settings where if we had a large number of cases, we would move to establish what are called community-based assessment centres rather than have everybody go to different general practices. We might set those centres up if we had an increasing number of cases. So we're just moving our planning into that phase as if we were in the manage it phase, although clearly we not yet. There was a question here.
Oh, that was my question.
Oh, okay.
Of the 100 cases that have been tested, what exactly is it about those people that has caused you to test them if they're not suspected to have coronavirus?
Yes, so the decision to test is with the clinicians who are assessing those people, and it would be a combination of their travel history and their symptoms. Now, in most cases, I would imagine the travel history is one that suggests they could have been exposed to coronavirus, but the symptoms and signs are not necessarily consistent. So they may not have had a fever above 38 degrees, they may not have had a cough and or difficulty breathing, but there's enough suspicion because they've got some respiratory symptoms. Most, of course, and as we've found in every case so far, those symptoms are due to other viruses which are generally circulating in the community.
There's reports coming out of the UK and Australia that perhaps the 14 days of isolation isn't long enough, that people are testing positive once they've come away from China up to 19 days. Are you relooking at 14 days? Do you still stand by that is the right amount of time to be self-isolated?
Yes, we're standing by that at the moment and obviously watching it closely. And I've alluded to the fact we're in almost daily discussion with counterparts in at least 4 other countries, but particularly with Australia. The weight of evidence is still that the range of for the incubation period is under 14 days. There are 1 or 2 small studies that have suggested it could be longer than that, but also a suggestion it could have been that a person was not necessarily exposed the first time, but exposed a second time, in fact, and that's what led to what appeared to be a longer period. We and other countries are sticking with the 14 days at this point.
So you had a list of things that you could spend that $3 million on. Is there anything the World Health Organization had said or asked other countries to look at urgently or highlighted? Perhaps that's what they were seeking, so research around vaccines.
Well, they're obviously very interested in our vaccine research, and in fact, by the time the meeting was happening, vaccine research had already kicked in a very major way in a number of other countries that have got that capability and capacity to do that. There was a lot of interest in coming to a coordinated international effort, and that's why the World Health Organization are putting together this process so that researchers can see what's going on. They're also mindful that they couldn't prescribe the research that specific countries could do, because health research agencies have their own things that they have to adhere to, and that varies by country and whether they're a charity or not, whether they're government funded, all those things. So that couldn't be very prescriptive, but general guidance.
Clarify, so are you making the money available and it's now up to groups or organisations to then pitch to?
Yes, so we're running our usual competitive funding process. So the aim is that only the best science will be funded.
With COVID-19 being so new, was there a sense, I guess there was a sense of, did you feel that sense of urgency from them to move fast on helping with the research?
Yes, so it seemed reasonably evident from the discussions at the WHO meeting that it was going to evolve in the way that in fact it is. There was a degree of confidence about that among the experts who were there. And so by the end of the 2-day meeting, I came away convinced that, that we needed to hear, and that's what we've done.
Just for New Zealanders that have been released from the Japanese hospital, what's the sort of process with them from here? Are they going to be offered any support, any involved?
No, we're not involved at all. I do know that the Foreign Affairs staff are in liaison with them and will provide support as required, but it's really pleasing to see they've been discharged from hospital well, and pleased they've made a good recovery.
And to clarify, so they don't have to quarantine for the quarantine once they're back in
No.
New Zealand?
No, they wouldn't. Well, thank you very much. Just two comments to finish with, if I may. One is just talking about the vaccine research, recalling that any vaccine, even with a concerted global effort, would be at least 12 months off. And obviously that is something that is informing our planning and response. And my other comment is that as we have seen over the last 48 hours, this continues to be a very rapidly evolving situation, high degree of uncertainty. You've heard me say that before, and we are watching closely and adjusting our response accordingly. Thank you very much for being here. Sorry, there was another question.
If there's a pandemic and we get a lot of cases here, are you confident that we are prepared in New Zealand?
I am, yes. I'm very confident we are. We have a very good plan. It's been tested, and the way that central government agencies and the health system has responded already to our efforts and what we've been able to do to date to, for example, look after the folk who were evacuated out of Wuhan, then the folk who came back from the Diamond Princess. Very significant cross-government efforts, and we're in daily discussions with the wider health system to ensure that we are geared up to respond. Thanks again. Kia ora koutou.